Moving right along, we have David Johnson, who is Operations and Management Officer in the Office of Population Affairs in HHS. He's responsible for the program management of several national grant programs administered as part of the National Title X Family Planning Program. Just get your slide up.
Well, good morning, or actually it is afternoon, sorry, that's where the day's gone, I guess. So thank you all very much, and again, I apologize for my delay. I had to oversee my director get kind of grilled on the Hill and Oversight Committee, so it was quite the experience. So this is a much friendlier, happier bunch of faces, so thank you for that. So part of, I guess, what I want to talk about, what really are some of the government initiatives? So I'm in the Office of Population Affairs. We administer the Title X Family Planning Program. So I think a couple speakers already talked about kind of the involvement of women's health and that overlap. And I think when we think about family planning, I will say this as a proud 15-year employee in federal Fed within the Office of Population Affairs and Family Planning, is that it is directed at women. When we think about family planning, we think about reproductive health. Not only the burden, but the opportunity that presents itself. And when in 1970, when the program was actually developed and signed into law, that's what the concern was, right? How to provide better services to those who need it. And at the time, those who were identified as being the need primarily were women. However, Congress does do things right every now and then, and not to offend anyone who is actually a sitting member of Congress right now. They also made sure to incorporate that the services under Title X were both for men and women, males and females. It was very clear of their intent. So going forward, it took us several years, several decades, to actually get kind of an idea of what that meant for males. We had men who actually males, and I'm going to use the term interchangeably, but so for the males that were actually going to receive services, part of the issue was, where are they going? What does that mean? Again, what are services for Title X, what are family planning, reproductive health services? And when you think about general overall health, we have to always ask that question, what really are the needs that present themselves? So as we get through a lot of different decades, and we finally came to the end of the 90s, mid-90s, we thought about what does the Title X Family Planning Program want to do? How do we want to increase opportunities, most likely specifically access, which also means, in a separate sentence, reducing those disparities, reducing those barriers that are there, and educating individuals. Not only just us as clients, as individuals receiving these services, but also providers, administrators, those that actually help manage our access to healthcare. So that's just a kind of a brief status kind of where Title X is. I think one of the things that we want to look at, and speaking a little bit broader at the government level, what does a program that addresses male health, what is it supposed to be? I am going to twist it to a little family planning because that's kind of what I do. But I don't think it's something that we should, that we have to be just set on. So one of the things that I think about when we look at that is, what is our role? One, establish policy. What is the guidance that we can not only come up with, take those research, take those data that are out there, combine that into words, combine that into action to help inform and support services and existing but also future programs. So taking policy at a very high level, but need to be informed by everyone that is here, but also those that I guess our clients, right, our customers. And I'll use the kind of interchange we think about business-wise, right? Who are we trying to meet the needs of, and what are those needs? For me, it's not to define those needs. And I think from the federal side, yes, we all have our appropriation, we all have where we're funding from, what our goals are. But when we think about the needs, think about those at a very general level. So when we think about policy, how does that policy inform kind of that action? Second part of it, I think, in looking forward is, what are those outcomes that we're trying to achieve? And for me, it's health outcomes. Those health outcomes are both direct and indirect. So are we meeting those needs of the individuals that are there? Are we also able to inform through that policy, through our programs, and then through the third piece that I'll get to is guidance, but are we able to achieve those needs that they're presenting with, as well as help anticipate and or bridge potential access in the future for those needs that have not been developed yet? Right? What are those things coming down the line? If we think about trying to provide healthcare across the lifespan, across generations, right? Where we are at 20, where we are at 6 months, right? We can use whatever cutoff point we have to be. We all have different needs. Whether or not that need is being identified by us and certainly before about 10, it's not really being identified by us, or not often. As we start transitioning later, it gets into possibly us identifying those needs. And I think as my colleague here identified, at some point it is our partners who are identifying those needs for us, whether or not because we know that they are, or whether or not we want to. So in the long run, what we're trying to find out is how can we impact that need, that identified change there, again, guided by policy, as well as help set up that down the road. So for us in Title X and family planning, a male probably is coming for, most likely a male is coming to our centers for a symptomatic STI, right? If we think about why would you show up, yes, we have wonderful men that are coming and are looking proactively, and how do I help my partner help plan our pregnancy and or prevent a pregnancy that we're not ready to quite have yet. But let's just take, for instance, having that access to a symptomatic STI. One of the things that we think about, we'd like to treat that. We can treat those. The majority of those we can treat right there, come back. What we also want to set up, and again, through guidance, through mission, through goals, through data, is to ensure that they either come back to us when they have that existing need, or they feel comfortable, and we hope they feel comfortable going to another healthcare provider, whether or not it's in the family planning setting, or if it's in primary care, or someplace else. So again, for me, policy is wider reaching. As the federal government, we have an obligation not only to do what we are paid to do through our appropriation, but also when we think about our mission needs to be broader than just exactly what we do, or we continue to run in those silos that we unfortunately have to have the 1 degree, but we are not required to stay in there. So the final thing I think is guidance. So when we think about guidance, how do we support both that policy? How do we support that mission, those dollars that go there? How do we continue to inform? Policy is, once it's finalized, it doesn't change very often, for good and bad. But guidance needs to continue changing. When we think about this, and again, because I came in late, I had the opportunity of hearing the impact of medicine, and we talked about Viagra, right? What is the impact that had? Ideally, everyone's going, oh, well, that just helped individuals and men with erectile dysfunction, or in a certain that needed to happen. No, the impact of that was much farther reaching. So when we think about those direct outcomes, I think that's an awareness that government has to have, the direct outcomes. Treating that acute need, or the identified need that might not technically be acute, and also anticipating what that indirect outcome was. For us, we want to make sure that when an individual comes in for services, acute services, whatever the services that are, that we also bridge that gap between relationships. In family planning, it's about relationships, whether or not it is a partner, it is a temporary partner, an occasional partner, a bound partner, whatever that relationship is. It's also for us to be able to ensure that through that guidance, through that clinical delivery of services, whatever our mission is that we help make that bond. And part of that is through that communication. What is that guidance? What is those research? What are those data? What is the research? And what is the other literature that helps us support that? So in the long run, I think from a government standpoint, as we all sit in the hallowed walls of government, legislative branch here, how do we best foresee the issues that we have, given our unfortunate, and I say that the resources, we're bound by resources, we're bound by time, money, and again, we sit in the legislative, I'm not in the legislative branch, so I can kind of dog them a little bit today, but right, there is a game that has to be played, so we just have to be farther reaching. So I think I have come up to my time, so I appreciate the opportunity, and thank you.
Thanks, David.